Okay, so coming back to the treatment. So basically, look, any kind of invasive surgery, by doing any surgery, we are interfering the nature. So it's not good at all. So if we could avoid the surgery, that's the best part we are going to have. So what we have to offer in Ayurveda, the treatment, this particular treatment is called as the treatment of Uttar Basti, which is highly specialized Ayurvedic urological treatment. In this, what we do in this, an oil-based medicine is introduced into the bladder using a small syringe and a small nozzle. There's no need to introduce a pipe or catheter into the bladder. With that small adapter, we introduce the medicine. This is absolutely painless, to be honest. We have treated patients of age ranging from 5 years to 96 years within last 22 years of different urological conditions. So you can just imagine from the kid of only 5-year-old. So mean to say that this is absolutely painless, not at all painful. So this medicine is gradually pushed into the bladder. Now, this strengthens the bladder. At the same time, it reduces the inflammation on the prostate, and the passage is gradually opened up with this treatment. So once the passage is opened up, obviously that person is able to pee naturally. It's a course of almost 21 days. So we need to do 21 sittings of this treatment, one treatment every day. So it's a course of 21 days treatment. Now, obviously this procedure is conducted under very rigid aseptic precautions. Whatever the things we use, most of them, they are disposables, single use. So we do take care of that way. So nobody generally suffers with infection during this treatment. So obviously it's our part to take care by all means. Now, along with Uttar Basti, we need to do one more treatment called as Panchakarma. Now let me explain Panchakarma as well. Basically, according to Ayurveda, there is an energy which is very crucial energy which we call Apan Vayu. Now you must have heard while doing Yajna we do Ahuti, saying that Om Pranaya Swaha, Udanaya Swaha, Dhyanaya Swaha, Samanaya Swaha and Apanaya Swaha. So out of these 5 energies, Apan Vayu is supposed to be the most strong and crucial energy. It governs 5 important functions in human body. It governs the physiology of urination, defecation, ejaculation, menstruation and pregnancy. Now, this particular energy is responsible for holding all the 5 things up to a certain limit, and once that limit is attained, the same energy expels it out. Like in case of urine, normally, unless and until almost 400 to 500 ml of urine is collected in the bladder, we are unaware of that. And once that much quantity gets collected, we get the urge to pee. So this energy, Apan Vayu, is holding urine up to that limit, and the same energy is giving us the urge. And when we visit the restroom, the same energy expels it out without efforts and the bladder gets empty. Same with defecation, stools. This energy is holding fecal matter or stools inside the intestines for 24 hours almost. And once that limit is attained, the same energy gives us the urge. As soon as we go to restroom, the same energy expels it out like this. So you just remember, whenever you get a proper bowel opening, it never takes more than 2 minutes. It's that quick. Same with ejaculation while having sexual activity. The semen is held by this energy up to a certain limit. Once that limit is attained, the same energy expels it out with force. Same with menstruation, the innermost layer of the uterus, that is endometrium, is held by this energy up to almost 28 days. And once that limit is attained, the same Apan Vayu, the same energy sheds it off in the form of menstrual bleeding. Same during pregnancy. This fetus is held by this energy for almost 9 months. And once that limit is attained, the same energy, Apan Vayu, induces labor pains and the process of labor starts and delivery occurs. So from all the 5 examples, you can understand that this energy tends towards gravity, downward. Now in case of prostate, obviously prostate is obstructing the flow of this energy. As the flow of energy is obstructed, that energy is disturbed, obviously we need to rechannelize that energy back to normal. And that's why in case of prostate, that energy is unable to empty the bladder completely. In some patients, when the frequency is here, obviously in that case of frequency, when the bladder is overactive, in that case bladder is unable to hold urine up to its normal limit. So both ways. So we need to rechannelize, restore that energy, and once we are able to rechannel that energy, everything is back to normal. Now how we do this? So for this, Panchakarma is there. So what is Panchakarma? So basically Panchakarma, simply speaking, detox. Now why to go for the detox? Let me explain this with one example. It's like we clean our house almost every single day. Still, at the time of any occasion like any festival or wedding, when we clean it completely, kind of thorough cleaning, deep cleaning, we find a lot of dust, debris, garbage inside, though we clean it every single day. Exactly in the same way, we throw many waste from our body in the form of stools, urine, sweat, gases, but something remains inside, and that something is collected over a period of years. Now, it's very clear that we do clean our house at least once a year, thorough cleaning. We do service of our vehicles regularly, but we hardly think of cleaning our own body. In fact, we are unaware of this. And basically, a human body is made up of billions of pipes. This is the biggest and longest pipe length is 22 feet. So obviously, there are only pipes, we call them as micro channels. So what is the waste is collected in the body, that waste gets stuck into these pipes and certain blockages are created. Obviously, there are certain consequences of these blockages. The first consequence is, what is the nutrition we eat, that nutrition doesn't reach to each and every part of the body in adequate quantity. So the body parts which are not getting proper nutrition, they turn weak day by day. In other words, we call this as the process of aging. So more the blockages, more the rate of aging. So it's very clear that, so this is the first consequence. It's a very continuous but gradual process going on in the body since years. Now the second consequence, the collected thing in the body is a waste, which is not good at all. So after some time, these wastes turn into certain toxins, and these toxins start interfering the basic metabolism of the body, the normal functioning of the body, and by interfering the metabolism, initially they create many problems. If ignored, they may lead to major diseases as well. And it's very clear that these toxins show their effect at the weakest part first. Like some people suffer arthritis that way, because the toxins are showing the effect at that part. So it's very clear that one must go for a proper detoxification first to remove possible maximum toxins from the body and to open up the blockages. Again, why this is necessary? Because if we don't go for the detox, if we start with medicines only, even the medicines will also not reach to the expected sites of their action because of the blockages. And once we do the detox, once the system is pretty open, once the possible toxins are out of the system, after that, medicines, even in smaller doses, they work very efficiently. So this is what the Panchakarma or detox is. It is called as Panchakarma in Ayurveda, to detoxify. Panchakarma, 5 procedures. It is simply impossible to go for all the 5 procedures at once. So the treatment of choice is selected according to the need of that person's body and the condition. Now for this prostate condition or bladder issues or urological issues, the most important treatment or the treatment of choice is supposed to be Basti. There are 5 treatments: Vama, Direction, Basti, Nasya, Rakta Moksha. So we are going to do the Basti for this. Now what is Basti? In that, we introduce certain oil-based medicine through the anus or back passage, using a very absolutely neat and clean, delicate rubber tube. This is also absolutely painless. We do this for even 8 months old kid, a baby. So this is painless, mean to say. So there are 2 types of Basti. One is given after dinner in the night. In that we use an oil-based medicine, 6 ml. That medicine goes inside the intestines. It never ever causes loose motions or diarrhea. In fact, that medicine stays inside the intestines overnight. It spreads from there all over the body, and what to the waste and toxins, they are stuck to the body tissue. They are gradually separated and brought to the intestines, and that person passes motions better than the normal routine next morning. But it never ever causes loose motions or diarrhea. Most important part. Now, next morning we start the morning Basti. Now, initially the dose is around 500 ml. It's a combination of decoction of certain herbs, certain oil-based medicine, certain salts and honey. Now that medicine goes inside, but it stays there for hardly 15-20 minutes. So whatever the waste and toxins, they are separated from the body tissues, that everything is sucked and flushed out. So that person has to pass motions maybe twice or thrice morning only. The rest of the day everything is fine. Now once the treatment proceeds, this is the main treatment to rechannelize that energy upon mind. The best part I would say of this treatment is, within 7 days that person is able to notice that there is very significant improvement in the energy levels. It never ever causes weakness. That's the best part of this detox. So generally we recommend at least 15 days course of Panchakarma, and both treatment, Uttar Basti, the initial bladder treatment, and this Basti treatment goes together. Now when a person is on detox, any detox, obviously we need to prepare that person's body for the detox. And for that in Ayurveda we have that Abhyanga and Svedana. Abhyanga, classical therapeutic Ayurvedic massage and steam, that is also medicated. Svedana means steam. Now this is not Panchakarma. Most of the people, they think that this is Panchakarma, massage and steam. Yes, definitely this is not Panchakarma. This is the pre-procedure for Panchakarma. So when we do this massage and steam with different medicines, all the toxins inside the body, they are very gradually, very easily released from the body. That's why it is there. So this is all about the treatment of Panchakarma, Uttar Basti and the prostate treatment. So all the very best. Hope I make this clear to you. Thank you.